You guys can come up. I'd like to invite the Children's Cabinet to take their places, and why they do, I just want to acknowledge that one of the great leadership decisions the governor made when he took office in his first term was to reconstitute a Children's Cabinet in the state of Minnesota. And for those who are not familiar, this is the bringing together of three commissioners, the Commissioner of Health, the Commissioner of Education, and the Commissioner of Human Services. And they are now joining us, and the crashed ice person is coming. I thought he was behind me, but here he is. He's coming. We've asked the director of the Office of Early Learning in the state of Minnesota, Melvin Carter, to be the facilitator of today's discussion with the Children's Cabinet. Please welcome Melvin Carter and the Children's Cabinet.
Good morning. This is an incredible morning, and it just bodes so well for us as a state, for our children. I remind folks every chance I get, I have two children. They're 8 and 6. So this whole Office of Early Learning thing is really just a big ruse to make sure that my kids are doing really well. And I think that if your kids are doing well and all of our children are doing well, then we're all doing well together. That works well for us as a state. My name is Melvin Carter, and I direct the state's Office of Early Learning. It's a partnership between the state's Departments of Health, Education, and Human Services, essentially with the charge of figuring out how those three agencies, how we can do better on behalf of children and families around the state, working together than we can do working separately. Essentially what that means is we're thinking across these agencies to figure out how we take the huge list of investments that the governor just mentioned and the huge list of investments that he just mentioned he'll be proposing soon, and make sure that they're not just a long list of things that we do, but that they're able to work together as a balanced portfolio of investments that are intentionally working together toward our shared goals. And I think that's really critical. Our governor's leadership has been phenomenal. I was sitting there just thinking how fortunate we are as a state to have a governor who is so committed to children and who so understands the importance of investing in the future the way that he does. And that's an honor. I also can tell you that we are really blessed as a state to have three commissioners who are experts in their field, who absolutely know what they're doing, who love and are passionate about children, and who like each other enough to spend a whole lot of time together, working together to make sure that we as a state are doing everything that we can do to get children off to the best possible start. And so I'm excited to hear their comments this morning, and I know you are too. So I'll cut my comments short and introduce our three commissioners, who I'm very excited and honored for the opportunity to work with. Straight to my right, we have Dr. Brenda Casilius, our Commissioner of our State Department of Education. Commissioner Lucinda Jessen, our Commissioner of our State Department of Human Services. And Commissioner Dr. Edward Ellinger, our Commissioner of our Department of Health. So I'm going to start and jump right in. All three agencies have a lot of current stuff and exciting and interesting stuff that has gone on since we last met together. I'm going to start and jump right in with you, Dr. Ellinger. Just about a year ago, some of my friends from all around the country called me amazed to ask me had I seen this thing that our Minnesota Commissioner of Health put out that stated that structural racism contributes to health inequities in Minnesota. That was a bold statement you made, and since then you've really advocated for promoting equity through a health in all policies approach. That sounds really great, and I'm certainly a big supporter of health, and I appreciate that work. But tell us, what does that mean? How do you operationalize it, and why is it so important to us as a state?
Well, thank you, Melvin, and I'm glad you talked about inequities and not disparities, because there's some disparities that are going to be natural, like you're going down the crushed ice and still being alive to tell would be something that I could not do, and there would be some disparities there. But as the governor mentioned, he talked about families and children having unequal opportunities, inadequate opportunities, and equity is really about opportunities, that everybody should have the opportunity to be healthy, should have the opportunity to develop normally, to develop to their full potential. And what we're seeing, and what we listened from around the state when we listened to people talking about the opportunities, it identified the fact that structural racism is at the core of many of the inequities that we have, many of the facts that many children, particularly children of color and American Indians, don't have the opportunities. And so as we talked about it, we realized that to be healthy, to really have healthy development, it's really not about medical care. Yes, medical care is important, but it's really only about 10% of the determinants of health. The real factors that determine health and prosperity and well-being are mostly our socioeconomic. And those evolve because of social policies. Policies from every single agency, from every single sector, from every single part of our community. So when we're looking at a health in all policies approach, we recognize that housing is so important to health and education and prosperity that housing policies really have to take a health perspective. Transportation has to take a health perspective. Economic development has to take a health perspective, because our data point out that if you can move somebody from that lowest quintile, lowest 20% of income to the second lowest, not a great amount of change, you can increase their life expectancy by 3.5 years. And we certainly know that the policies that impact housing, that impact transportation, that impact economic development, certainly impact families and children most dramatically. And so if we're going to make some progress, everybody here has to be engaged, has to be involved, and you have to look at the policies that you're doing, both how they impact health and healthy development, but also how they impact equity. Are they really disadvantaging some populations over others? And when we even looked at the state health department, we looked at our policies and recognized that some of our policies really structurally disadvantage some populations. So we need to acknowledge that and then make those changes. And then we have to ask the policymakers every time they look at a policy, what does it do to impact populations of color and American Indians? What impact does it have on equity, and what impact does it have on health? That's the health in all policies approach.
Thank you very much. I think that's critical, and it's a critical component of how we think about our work working together, that we know, and this is as the governor pointed out, that our work to get children ready for kindergarten and reading by 3rd grade and all of the education and learning goals that we have for children really relies on children being healthy, showing up to school ready to learn, being healthy, showing up from a stable family, and being able to kind of have, as we talk about ready for school, ready to learn, I mean, it really talks a lot about socio-emotional readiness. Commissioner Jessen, the Department of Human Services has a whole lot to do where social-emotional readiness for children is concerned, and a huge part of healthy development is behavioral health. As the mental health authority in the state, how is DHS making sure children are getting the services they need?
Well, thanks, Melvin. I'm not going to go through the whole list, but I think we all know what an issue this is throughout Minnesota, for all of our children. Close to 20% of kids have a diagnosable mental health condition, 20% by the time they're 14. And we know that a lot of them aren't diagnosed and they're not treated, and that just leads to all sorts of problems. One of the most exciting things, so the thing I'm going to talk about, is the doubling of our school-length mental health grants. We rolled those out last year, and it's just phenomenal. I'm going around the state talking about what can we do to strengthen our mental health system. But I always start with, what's working? And people say, boy, that is making a huge difference. And that really started when I was up in Virginia and Hibbing visiting what they were doing, bringing kind of mental health workers into their schools, and they're able to identify challenges earlier and get those kids into treatment. And the first thing I said is, I've got to talk to Brenda Casillas about this. And we talked to Ed, and we said, as a children's cabinet, we're going to champion this. We went to the governor, he put it in his budget, to the legislature passed it, and so there was an additional $45 million to try and do this. We're going to reach 35,000 additional kids. And those aren't just poor kids, though a lot of them are. Those are kids from every background that we're going to help. Minnesota's held out as a national model. We're doing more of this than any other state. So that's something that I think is really important. I could go on, but I think that's probably the biggest thing that we think is really working to help kids. And can I just say, especially important, I heard from parents in Greater Minnesota, think about it. Even if you know your child needs help, you have to go to school, get them, drive an hour, maybe an hour and a half to a mental health professional, then drive back. You're taking time off work, and it's more likely those kids then aren't going to get the help they need. So I'm really excited about how this is working.
Thank you very much. Commissioner Justin, you mentioned the fact that our state is really held up as a national model, and that's really true across all three of these agencies. And I get a chance to talk to some of my colleagues around the country who look and say, how is Minnesota doing this? And I think we don't take enough time to recognize, as this is a room full of folks who are focused on all the work that we have to do together, and we are relentless in our approach. And I think sometimes we could stand to take a second and take a step back and go, wow, look at all that we've accomplished, and look at all these other states that are paying attention to Minnesota and are really recognizing the work that we've done on behalf of children. Commissioner Casilius, that brings me to you. Minnesota is constantly and for quite a long time has been recognized as having one of the best public education systems in the country. Commissioner Ellinger talked about disparities, and education is an area where we have a lot of disparities as well. In some areas have been pointed out to actually lead the country in disparities. My question for you is, why do education disparities exist in a state with as great a public education system as Minnesota, and what are the most important things that we can do to ensure that we are serving every child every day very well?
Well, thanks for that question, and I think it's about keeping equity at the front and foremost of all of our work and being very intentional and deliberate about it. What are the causes? Ed went through some of those. Cindy talked about them, and the governor actually laid out a lot of the causes for why we have these kinds of disparities in our schools, from structural racism to wages and jobs, transportation, housing, mobility, health, students coming who just don't even get a great first start. And that's why we're all here, right? And when kids start behind, then they have a really hard time catching up. And so we know that the reason we have these disparities isn't just because when they come to schools, all of a sudden we test them and we see a disparity. We can see these disparities already at age 1 for their educational attainment. At birth, you see these things when they have health issues and low birth weights. We know right then and there that we have to intervene and start earlier with children so that they can come to kindergarten ready to learn, feeling confident, socially adjusted well, to be able to handle a learning environment and be able to work and meet the objectives that we have for them. So that is a really huge piece. So it's not just a school issue or a school problem. It's going to take all of us. Mm-hmm. And we have good examples of where people are coming together, like the Northside Achievement Zone in the St. Paul Promise neighborhood and other transformation zones across the state that are working together collaboratively, nonprofit, private, county, city, state, coming together and saying, how do we solve these multiple issues in a comprehensive way so that every child gets a great first start and that our public schools are excellent. You heard the governor talk about in his inaugural address, every child deserves an excellent education. And unless we start giving them an excellent education and great health opportunities and great housing opportunities and great job opportunities and make sure families are stable and don't have crisis, we will continue to admire this problem rather than do something about it. So this is a call to action to all of us. And we've made some progress over the past 4 years, but it's not fast enough. We have to put the foot on the accelerator pedal because we are becoming much more diverse. Our children are poor. Over 50% of our children in the nation are living in poverty condition. How can the richest nation in the world accept that? I just don't know how it's acceptable. So it should compel all of us morally, but also in our own economic interests and the betterment of this great state.
Thank you very much. I'm going to ask some quick questions. We've got about 10 minutes left, and I want to ask some quick questions of you. that I'm sure a lot of folks are thinking about. Dr. Ellinger, I'll start with you. And just briefly, can you share with us, you talked about opportunities to be healthy. Obviously, one of those huge opportunities is access to health care. Can you share with us briefly how the Obamacare-funded expansion of MNsure has transformed the landscape of children's opportunity to be healthy in Minnesota?
Well, certainly Minnesota has one of the best healthcare systems in the country, and we've been the leader in getting people into the care. But the ACA has really brought the uninsured rate down, and that really is insurance for families is really an important thing, takes a lot of stress off. It has also added a lot of services particularly focused on kids and families, reproductive health care, not making pregnancy a pre-existing condition that really would get you excluded. And we know that healthy pregnancies are one of the biggest factors for healthy child development. Home visiting has been part of that. Dental care. I mean, it really has, in addition to securing access to medical care, it has broadened the scope, advanced some of the preventive services. But we also, as I mentioned first, the health in all policies approach, it's not everything that is needed. We need to continue the focus on all of the other efforts to really focus on the health of kids.
Mm-hmm. Thank you. Commissioner Cassellius, Governor Dayton mentioned school discipline and expulsions and suspensions. That's been a hot topic over the past year. How do we reduce expulsions and suspensions while giving teachers the tools they need to maintain productive classrooms and time on task?
Well, I think that the best thing we can do is support our teachers in that work, and there's a number of things. One is the multiple tiered systems of support. Many of you are familiar with RTI models, which really look at how children are doing and then provide interventions for children. Mm-hmm. The work Cindy's doing with the school-based mental health and support services, partnering with our community healthcare providers to better meet their needs, MNsure system and healthcare system to be able to provide that kind of healthy support for students and families around social emotional issues that are happening, family crisis, and making sure many kids, when they act out in class, it's because they're acting out because something happened. There was something that happened in their environment, either in that morning or has been happening in their environment for many, many days or weeks. And so it's getting at the root of that cause. And you need folks in the schools like counselors, social workers, nurses, support staffs. And because of the significant budget cuts we had over the previous 10 years before this administration, and we're still now recovering from that, those are the positions that got cut in our schools. All of the support positions got cut in our schools. Nurses. So now we have clerical people handing out medicines. So it's just not, you need to have good support systems in place. We also do things like PBIS, positive behavior intervention supports, giving teachers the tools and skills to be able to know how to work with children, how to de-escalate crisis, and how to provide other opportunities for them in terms of making sure that they can manage their own and cope with their own behaviors. And then we have another program that we allow for school districts to use some of their special ed money called ATSES, Alternative Delivery of Special Education Services, so that we can prevent students from getting into special education earlier by looking through problem-solving model and being able to provide interventions earlier to students. So we do a number of things to support that effort. Still more is needed, because even though we've seen overall statewide a drop in our suspensions, we still see the disproportionality for kids of color and American Indian students and kids with disabilities. And so we have to also tackle this reality that there's still these structural pieces in there that are causing kids who are kids of color, American Indian kids, and kids with disabilities to get suspended more frequently than white students are.
Indeed. Thank you. Commissioner Jessen, I know you've worked closely with Governor Dayton to ensure that the child protection system in Minnesota is very capable of keeping children safe while also doing everything we can to build and strengthen the families around them. Would you please briefly share your thoughts on how we as a state can best balance those two paramount goals?
Well, Melvin, someone you may know, Ramsey County Commissioner Tony Carter is co-chairing the task force. Representative Preacha, who's here,
I'm a big fan of that Ramsey County Commissioner.
You know, and I think the work the task force is doing, and now it's moving into the legislative, and we have some great legislative leaders on this, is really critical. You know, I think that some of us who are in the who know so well the child protection system, and we know the thousands of children that are protected because of the hard work that is done by our county workers and our nonprofit leaders, and we save so many children but there are too many children that we're missing, and we can do a better job. And I think there are a lot of recommendations that have come out of the task force. Initially, we have more coming, but I think the biggest thing that we are trying to do is shift the conversation and make sure that when we're talking about child protection, the first thing that's foremost in our mind is the safety and well-being of that child. What's in that child's best interest? But some people are saying, well, okay, then that's not about engaging and helping families. When, of course, the truth is, as you, I think, know, Melvin, for most situations, the best thing we can do to help children is engage and stabilize those families that the governor talked about as being so at risk. They're not mutually exclusive.
Right.
But when it comes down to what's the most important, it's got to be that child.
That's right. Thank you very much. I think that's really critical. I'm going to ask you guys a couple of questions. We're going to go into the lightning round now. And so I'm going to ask you a couple of questions and rapid fire style and just ask for your quick thoughts. One thing, we talk a lot about our interagency work. I'm really interested to hear all of your thoughts, again, very briefly, on what's one thing each of your respective agencies can do to better support the work and objectives of one of the other agencies or commissioners on the stage with us. We'll start, Commissioner Casilius.
I think we do a really good job of working with one another, and I'm pretty proud of the work that we've been able to do together, trying to think of how we improve on that, I think it's just really continue to be in close, we email each other and talk to each other and call each other all the time, so I'm having a hard time with that question. I think it's maybe try to break down a little bit more of the barriers and figure out ways to share funding a little bit more, maybe.
I agree. Any other thoughts, anything else to add?
We started on this, but the more we can do working together, and this is mostly with the Department of Education around Parent Aware, the better off all of our kids are going to be, because if it's making sure that those children are ready for kindergarten. To do that, we've got to be in quality child care, and we're off to a good start. We've got to do more of that.
And the health department lives on data, and we can share a lot more data, and we can do the data analytics, and we can do some of the health impact assessments that in the different programs that really that shows the impact that some of these policies and programs have on the health of kids.
Commissioner Ellinger, what's one issue we've made great progress on that you're very proud of?
I think we've made a great progress on changing the conversation about what creates health, recognizing that it's not about medical care. It's not about individual choice. It's about what we as a society do collectively to assure the conditions in which people can be healthy. We're changing the conversation, and that narrative is really, really important because that sets the values for where we move ahead.
Commissioner Jessen? Okay, listen. Do me a favor. Would you do me a favor? Because you're cutting into my time here.
And please don't cut in on my
Every time you want to applaud, just put a tally mark on your piece of paper, and at the end, we'll give them a big, huge round of applause. Can we make that deal? Okay, good. All right, Commissioner Jessen.
Starting actually this month, we're going to make huge progress for a bunch of children that aren't usually talked about, and those are kids in our foster care system who are waiting for adoption because their parents' parental rights have been terminated, and they're waiting sometimes months and years for permanent families. And so the legislature and governor supported what we call a North Star, so that we are increasing the help families get and relatives get if they adopt those kids. We're going to have more children in permanent homes, and that is wonderful.
Absolutely. Commissioner?
Mine is an easy one, all-day kindergarten. So I'm so excited about the governor's commitment to that. But the governor also mentioned in his comments about standing strong in that 2011 session so that we could get that small investment in pre-K, and I am so excited about the pre-K, and I'm excited about what the governor is going to do in his future budget around pre-K, and so that's going to be a future thing that I'm just so excited about.
Okay. Thank you very much. I really appreciate your time. I really appreciate your thoughtfulness, and I really appreciate, I know I'm speaking on behalf of all of us when I say I really very much appreciate all three of you, your commitment to Minnesota children, and the understanding the context that I heard as a theme is that children don't just sit in one space at a time as patients or as clients or as students, but that the children we serve live in the context of families and communities all around which we can create the opportunities to be healthy and thriving students. Let me tell you, I work very closely with these three commissioners. They work very, very hard, and often it's a thankless job. Can we prove to them right now that it's not a completely thankless job with a huge round of applause?